Right, welcome folks. We are just giving everybody a moment to get into the meeting room. Thank you for being with us today. We will give it just another moment before we start introducing our speaker and going over a couple of basics for today's presentation. All right. So welcome everyone. We are pleased to bring you another Florida Asthma Coalition Lunch and Learn webinar. Today's focus is on healthcare with heart, a managed care approach to addressing social determinants of health and whole person health. And we are very pleased to have with us today as our presenter, Tony Jones from CareSource. So Tony is the Senior Director of Social Determinants of Health Growth at CareSource, a member-centric managed care plan. In this role, she works with internal market teams and external partners to address social care barriers and health inequities through the CareSource Life Services model. Over her more than 15 years at CareSource, Tony has gained a wealth of knowledge working in various progressive leadership roles in quality accreditation, business development, and serving as a career mentor. Tony works to amplify the voices of those with lived experience as pivotal informers of social strategies to improve physical, mental, and social health. She's a managed care professional with passion for community empowerment, leads the program and partnerships team focused on impactful collaborations. And Tony specializes in the areas of retail, community, and anti-human trafficking. Her team co-designs initiatives and programs with community thought leaders and influencers. She has a bachelor's in sociology, which we're quite familiar with from Spelman College, a master's in public administration from the University of Delaware, and also a master's in project management from Keller Graduate School, and is a certified life coach. She also participated in the ACAP Leadership Academy a few years ago, got designated as an emerging industry leader with managed healthcare executives. She has a distinction that way for leaders of key initiatives unique to the healthcare industry, focusing on advanced managed care roles. She channels her commitment for service with various community organizations, including the Miami Valley Child Development Center, and the Root Cause Coalition Board. She serves on the National Care Portal Advisory Committee, lives in Ohio with her husband and 2 children, enjoys beaches, traveling, and experiencing different cuisines. So please give a very warm welcome to Tony Jones, who will be leading our presentation today. We will have a few participation opportunities during the presentation. So Tony is going to ask the attendees some questions periodically. And if you would like to participate in those discussions before the formal presentation wraps, we would love for you to chime in the chat to let us know that you would like to contribute. You're also welcome just to contribute your comments in the chat, and we'll make sure that they get read out. But you can participate either way, just let us know, and we will be monitoring our chat to make sure that we can call on you. Also, for those of you who haven't met me before, hello. I am Dr. Zan Novakovsky, and my pronouns are they, them, and theirs. I have been the evaluator for the Florida Asthma Program and Coalition for over 12 years now. So I am really looking forward to this new presentation and to hearing from all of you. We will also have a Q&A session after the formal presentation is over. So you've got multiple modes of access to participate and learn more. And we'll be sending out a survey after the webinar so you can give us your feedback. I'm going to give the floor to Tony, and I will see all of you in the chat as we get those discussion questions going.
Thank you, Dr. Zan, and thank you everyone who had a part in getting us to today. I'm really excited to be here today and appreciate everyone's attendance, those that will watch live and those will watch the replay on the YouTube channel. So happy to be here, and thanks to the Florida Asthma Coalition for this opportunity again. So really excited and welcome to a managed care approach to addressing social determinants of health and whole person care. At CareSource, we are truly invested in the whole person, the totality of an individual, the family, the neighborhood. And we are interested in really providing those services that really wrap around them from a community lens to be able to impact care. So not from just the healthcare realm, but also the social care. And so we're delighted to have this opportunity. I did just celebrate 16 years at CareSource on May 5th. So really excited for all that has happened. And we were founded by a social worker. And so just to see these moments that have really aligned themselves through my experience at CareSource, it's a delight, like I said, to be here. I want to start with a quote by John Green, and it says, "Disease only treats humans equally when our social orders treat humans equally." So the next slide, please. I'd like to start with an overview of CareSource, please. And so CareSource is a managed care insurance company, meaning that we are funded through federal and state funding to provide service to our membership. We are in multiple states, including Florida, and we have 2.3 million members and 5.2 million members of our workforce. So we're a smaller fish in the pond, like we like to say, but we're really excited that we've been able to lead the charge in the social care realm, or social determinants of health, or social drivers of health, however you hear them. And we serve multiple membership types. So we have Medicaid, Medicare, those who are dually eligible and have that wraparound services, as I said. We've made a significant investment in the life services model, which we'll talk a lot about today. Giving that whole person. Life services is our brand name for our social determinants or social drivers of health work. And we have comprehensive enhanced services that our member can take advantage of, including rewards and incentives for visiting a hospital, for visiting their doctor's appointments, transportation. We have some asthma remediation that I'll talk about later. So there are lots of things that we really want to focus on. And then we make valuable investments in our local communities as well, hand in hand and shoulder to shoulder with our partners, both retail and non-retail, in different areas of focus to really move the needle on improving healthcare as well. Next slide, please. So this is our footprint. As you can see, we're all from Florida, so shout out to the warmer weather. Wish I was at the beach today, but just happy to be here today. Next slide, please. So we want to dig into from a perspective of the social determinants of health, and based on the participants that will be here today, we know that you all are very well aware that much of what happens, only 20% is that medical component. And so this is not new, but I just wanted to ground us all to make sure that we were all speaking the same language today, and that we understood that that physical environment, health behaviors, and others, particularly those with asthma, a lot of them are focused and really a result of that built environment. And we're going to talk about that more. So some examples of social determinants of health, as we've talked about, can be employment, education, food and housing, and social support. And we always like to say, SDOH focuses on the person outside of the patient. So once they come into the hospital setting, there's a whole life that is represented beyond what we see as a patient. They are a family, they are members, they are people in the community. And so a lot of that has to do. And so we're going to dig really deep into that today to really focus. So poverty is another way that we look that there is unequal access to healthcare and poor environmental conditions and educational inequities. And so that's why our life services program, particularly because we work with our members who are experiencing poverty. Poverty is not who they are. It may be just something they're experiencing. It's something that we like to walk hand in hand with them to really remove some of those obstacles and barriers that can be in the way of allowing them to move forward. Next slide, please. So the CDC's definition is conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes. These conditions are known as social determinants of health. So just grounding us again on this definition. My first question, please, is can anyone guess how much our government spends a year on our poverty programs, which are our safety net programs? Can you please add in the chat how much money a year our government spends on poverty programs? No answer is wrong. 1.5 trillion. Okay, thank you for that. Anyone else? We'll give it 5 more seconds if anyone wants to take a guess. 2 billion. Thank you. All right. Thank you, Shelby. We'll advance to the next slide. The answer is 1 trillion. So thank you for those who guessed. Appreciate you. So here we see there is a myriad of different programs that many of us are associated with or may work with or have heard of. Here we have the Summer Food Service Program. We may have SNAP, which you may know as food stamps, our Supplemental Nutrition Assistance Program. We have foster care. We have Medicaid, Medicare. We have WIC. So these programs provide that safety net or for cash assistance or programs that really serve as the support for the members and the clients that we share. So a big part of this conversation is a managed care organization, particularly one that focuses on Medicaid, also engages with many of the same members for those individuals who access these safety net programs. And so from that, there's often this kind of siloed approach. While these organizations and initiatives and programs are very well intended, they often require repetitive applications. They require the need for the applicant to have to get off of work to go apply due to the hours of operation. There's also ways in which that, in some ways they don't qualify based on the very stringent rules that apply to them. And so while there is a lot of money, $1.5 trillion, $1 trillion that goes into these programs, we have found for those in the social care arena that there isn't a lot of collaboration with them and there is a lot of separation. And so we like to say that at CareSource, we like to connect the dots for our members and walk with them as they work to navigate this very well-intended but siloed process. And so that's where we were able to come with our life services program, which I would like to talk about on the next slide, please. Before we advance, and please stay there, Shelby, can anyone add in the chat what you think about when you see, can we just go back one more? I apologize. When you see these bubbles, all of these great programs, what comes to mind here from the lens of our members or our patients or our clients? Maybe one word could you add in the chat that seems to come to mind? How do we think they feel? Is it easy? Is it difficult? Is it overwhelming? I'll wait a few seconds for us to add some ideas in the chat, please. Overload, yes, absolutely. Overwhelming, yes. And when you think about chaotic, absolutely. Confused, yes. Thank you for those responses. And when you think about all of the day-to-day activities and all of the high level of stress that is associated with living in poverty, while these services are available, they just produce even more stress, chaos to an already an existing workload, overload, confused and chaotic. Yes. So I just wanted us to kind of ground ourselves into thinking, like sometimes it's, well, these services are available. Yes, they are, but there's a lot that comes to them as well. Thank you. Next slide, please. So here we have our CareSource Life Services. When we first started, I talked about our brand name for Life Services is our SDOH is called Life Services. And so we started this program at CareSource over 7 years ago, and we are proud to be kind of the trailblazers, if you will, in managed care to really start the focus on SDOH. Now, I will say, being founded by a social worker, we didn't necessarily start just then because we always had programs, but really having that dedicated team that was added. Prior to this, we did have social workers on staff, we did have community health workers, but having a dedicated life services team was really birthed about 7 years ago. Within that, we really started with the Job Connect program. And from there, that was really started during Medicaid expansion when the question was asked to our members, how can your insurance company help you? And the resounding answer was, help me get a job. The desire was to become self-sufficient, to remove themselves a bit farther from those safety net programs, and to really have an opportunity to potentially remove themselves from Medicaid. Now, while that's counterintuitive for a health plan to say, yes, we want to help you get off of our per member per month role, that was something that we realized was in the best interest of our community and for our membership. And I can successfully say that we have been able to do that for many of our members. They've been able to gain employer-sponsored insurance. They've been able to receive promotions. They were able to receive higher levels of education as a result of our Job Connect program. And that's where it started. And we've also moved to other programs like our housing program that help with housing assistance. We have different housing investments. And one of our programs called Healthy Beginnings at Home is a program where we used housing as an intervention for pregnant moms, where we were able to see astronomical improvements in healthcare, as well as a reduction in NICU stays. And I'll talk a little bit more about that program when we get to the end of our presentation. Food Connect focuses on food access, food insecurity, and food education, really securing that food for our members and being able to help them wrap them around those safety net programs that are available. As we talked about, we do have our SNAP program. And so that's the way that we are able to allow our members to access that federal government and to make sure that they understand that they qualify and assist them in helping to apply for that. In addition, we have a program with a food provider to provide our members with food post-discharge after they had a minimum of one stay in the hospital and one night stay. And from there, we were able to see a reduction in return to the emergency room post-discharge. And we're also able to see an improvement in their health and well-being as well. As we think about food from a perspective, I'm gonna say like food is prescription. When we look at it, we can see that if a person is not able to take their medications post-discharge, if they don't feel well enough to cook for themselves post-discharge or any other time, we're setting them up to return to a pre-existing environment where they left and not allowing them to be able to capitalize on the moment for it to be able to return to optimal health. Another program is Care for the Caregiver. We see that, which is Caregiver Connect. We understand that our caregivers are huge allies and partners in the well-being of our members. And so while a member may not be, a caregiver may not be on the CareSource role, there may be taking care of one of our members. And so we have really focused really heavily on trying to focus on how we can better service our caregivers and give them the care and attention they need in an effort to ensure that their mental and physical health is at optimal levels as well. And then Peer Connect, we understand that providers working with peers that have endured substance use disorder or any mental health illnesses, we're able to walk through our members in that regard and really have that peer-to-peer connection and improving awareness and access to those supports and services as well. So that in a nutshell is our life services program that we're extremely proud of. We'll go to the next slide. From the life services component, there is a journey that we realize that to enroll in this program, it is a 100% optional program that is not required, but it is a benefit to our members. We realize that there is no wrong door approach for our members to be able to access these programs. And then we're connected through community-based organizations. We're connected through providers from the doctor's and physician's office. And someone also can self-refer themselves into the program as well. After that time, we have a assessment that is completed. We like to use the PREPARE assessment. That is an evidence-based assessment. And with that, we are able to uncover and understand some of the needs, the really urgent needs that for our members, and how to move them forward. After that, a life coach is assigned to them, and they're able to walk them through. Our life coaches are certified life coaches, and we're excited about the work that they're doing. And they're able to walk with a member really up to 2 years post being in the program. And so we're excited. There really isn't an end to it. They always have that support. So even if they say they graduate from Medicaid insurance, we're still able to work outside of the program. And then we're able to provide assistance through our member assistance program is another thing that we provide. So say a member needs access to steel-toed boots for a job. We are able to reach into our assistance as a benefit and to be able to provide that for the member as well. Because we know that sometimes you need funds to be able to work a job, and we want to provide that and be that source of support for them as well. So that's pretty much our program in general. We do have lots of great success stories and member stories that have come out of, and we receive a newsletter with those. Those are very inspiring stories, and it just helps to keep us encouraged to continue to move forward as we advocate on behalf of others. So the next slide, please. So one thing that we really focus on is health disparities and health equity. And so as I said in that first quote, disease only treats humans equally when our social order treats humans equally. So we know that there is a long-standing history of disparities and some racism and segregation within some communities of color, as well as those living in poverty. And so we like to make sure that we have opportunities, and this is really our continuum of care of sorts. So I want to hit on this briefly. So we have that integrated care management model. There we work with the care. We have nurses and community health workers and others that work from a perspective. And then we have community education and collaboration. We understand that we are really connecting and convening our members to the work, but the work really happens in the community. It really happens at the food bank. It really happens at, the housing authority. It really happens at those those grassroots nonprofit organizations where the work is happening. And we also know it happens with retailers. So we have a long-standing relationship with some retailers that I'll speak of, but really meeting our members where they engage, where they work, where they play, and being able to provide those social support services also at the government level is an extremely important way of the success of reaching our membership. We also have a lot of provider engagement and training that we do, helping to understand how our members are engaging with some of their claims history and things of that nature to help uncover some of those behaviors. And I'm going to talk about that a little later when we get to talk more about asthma, but an initiative that we have going on. But really, our providers are a big part of us as well, because they are engaging with our members and providing them when they have those urgent, and hopefully they're engaging them to have that health home as well when it's not an emergency as well. We do a lot of data collection. We like to focus to make sure that we are doing any predictive of anything that could potentially happen and really working. So we have a robust data and analytics department that also focuses and helps us to serve our members in multiple ways as well. And then we have an enterprise health equity committee that focuses on really engaging internally so we can engage externally to make sure that we are hitting on all cylinders. We have a member advisory committee that is comprised of our membership, and we also have a circles program is what it's called, which does a lot of surveys, if you will, to be able to engage our members especially. And we've really uncovered a lot of information from our members, and that's what we're creating it all for. Creating in a vacuum does not help anyone. It's very important that the member is at the center and the voice of the member is the loudest for the opportunities. And then, as we talked about, life services. So from your perspective, I'll ask another question. What are some other ways that you have focused within your organization that you're proud of, that you've worked to mitigate health disparities or amplify the voices of those that you are serving, whether it's your clients, whether your patients or members? What are ways that you have amplified the voices or focused on health disparities? Is there an advisory group? Is there a voice of the customer that you've implemented? And I will wait just a moment for that. Olga is raising her hand. Hi.
Hi. So with the Health Council of Southeast Florida, we work with a number of counties in the state of Florida to help implement their minority health plans. So for one example, the Martin County Minority Health Plan focuses on addressing disparities in overweight and obesity in the county. And so there are multiple projects looking at social determinants of health that impact those things. Such as, and one project is developing a farmer's market, and another is focusing on better data collection on social needs experienced by community members. So that's one example.
Thank you, Olga. Appreciate it. That sounds like a very collaborative initiative and program that has birthed a lot of different and great outcomes. So thank you for sharing.
Yeah, definitely. And like you mentioned, the partnership with the advisory council is essential for that.
Thank you. Yes, the voice of those who we are serving is most critical in everything. So, and Diane in the chat says online service to engage with subsets of our membership to gauge opinions and thoughts on a variety of topics. Absolutely. So Diane is a colleague of mine, and so being able to work with her, particularly on retailers, she's our director of retail partnerships, and being able to gauge from the retail side, non-retail side, and kind of merge them together to get those opinions is very important. Eric, thank you. The floor is yours.
Yeah, thank you. This has been really insightful. I don't know if this is useful at all, but we use a process called asset-based community development. So we actually get the equivalent of a life services coach, a community connector, will actually go out and knock on doors. And we'll ask about these kinds of things, but also ask, what is the thing that, if you could wave a magic wand and change one thing in the neighborhood, what would it be? And so then we actually start to engage people with each other and mobilize folks to create a different environment, a different condition. So we're actually working more and more upstream. So we're changing the environment so that there's less occurrence of the issues that we're seeing in terms of SDOH.
Thank you for that. And thank you for sharing that very insightful question, because I feel like there's so much hope connected to that question as well. But then like moving it forward to say, if I could change. And so I feel like people feel like very heard with that question. So thank you for sharing your work. Really appreciate it. Okay, we'll move on to focus a little bit more on asthma, which is the topic that we are all here for. So we'll go to the next slide, please. So I just did a little research through the National Library of Medicine, and there was an article or research study that was called Social Determinants of Health and Asthma. And so I thought it was a perfect way just to kind of bring out some of and amplify some of the thoughts that I'm sure many of you know, but once again, I just want to ground based on this discussion. So we know that substandard housing, urban and rural neighborhoods, and race and ethnicity are associated with poor asthma outcomes. So I'll talk a little bit about some of these areas for the next few slides, and then we'll talk to you about some of the CareSource solutions that we have in place to be able to help remedy or support health in these areas. And then, of course, living in poor health and housing conditions associated with increased rates of asthma and hospitalization. Sorry, I was looking at the chat. So I want everyone to picture your childhood home or your childhood neighborhood. And was it an older home with like pipes? Did you have a yard to play in? Did you stay on a busy street? Did you have sidewalks? How close did you live to a major highway? Did you live close to a grocery store? And so as we think about, once again, putting ourselves in the mindset of those that we serve every day, those with asthma, those experiencing social determinants of health, the air we breathe and the water we drink, as we know, affects us in a very, very large way. And so as you think about approaching your work on a daily basis, how can we bring a different level of insight to the care in which we approach our members, our clients, talking to them? But I want to just have us reflect on how our childhood or how we've experienced our childhood or growing up through someone else's lens, how it affects how we approach our work today. And so you don't necessarily have to respond to that, but the question is really to just invoke a level of empathy and understanding and putting ourselves in someone else's shoes. So I'll give us just a moment to think about that. So individuals, after lots of different segregation and living with more air, water, and noise pollution in neighborhoods, this puts, as we know, individuals in a higher likelihood of having asthma. And so the solution here from a CareSource perspective, and while I know that is not the only reason that someone has asthma, I just wanted to kind of amplify that today, that we do have what's called an asthma remediation program where we are working to help improve environmental circumstances for our members, providing with bedding, specific vacuums, pest control, and some other areas that would really help to improve their lives. And so there is a cost associated with that CareSource works to cover, and it's an annual benefit they have, potentially up to a lifetime benefit. And so while this is a disparity, we are working to provide solutions as a managed care plan. Next slide, please. And then we know, as we talked about, that poverty also links to increased asthma prevalence, emergency room visits, and hospitalization. And so we understand that, that is an inequity in itself, and that we want to continue to provide opportunities to assist our members in that realm as well. The next slide talks about, and I just want to look at a couple of the quotes here. The percentages rather, so 74% of previously labeled hazardous areas are low to moderate income neighborhoods today. When living in Dayton, Ohio, and we had a low income or subsidy housing community, we know that there is a national housing crisis and shortage. We had the tornadoes where we made national news a few years ago. And unfortunately, some of those housing units that were deemed unlivable were actually opened up post-COVID for members or individuals to live in. And so that's how deep we are into the housing crisis. And so we understand when individuals have to live in conditions where there is mold and lead and other things it just continues to exacerbate the asthma conditions. And so this statistic definitely supports that. And then 60% of those neighborhoods are predominantly minority neighborhoods, as we know as well. So the next slide, please. And this is what we have already talked about. So I'm going to go to the next slide. And here we're going to talk about Bobby's experience. And so this is also a time for some participation if you want to come off mute or if you want to add in the chat. So Bobby's experience, and I know everyone, but just to ground us, I'm going to just read some highlights. He's 17 years old, lives with this 45-year-old father who is a single parent. They live in an urban area near a manufacturing plant. Bobby and his father have been on Medicaid for the past 4 years since his father lost his job, so they have situational poverty, and they live in public housing. Bobby has vaped since he was 12. He was diagnosed with severe persistent asthma 3 years ago, and his symptoms have been worsening lately. He presented at the ER 2 times during the past 30 days, and he has managed to reduce his vaping since the wave of ER visits, but his attempts to fully quit have not been successful. Lastly, Bobby has been prescribed several regular medications for his asthma, and his last appointment with a specialist was 10 months ago. He's had difficulty taking his medication regularly as his father is not always available to get prescription and lacks consistent transportation. After his last ER visit, Bobby was prescribed new medication. However, he has not been able to use it. So I want us to spend a moment from an interaction lens in the chat, or if you want to raise your hand, to talk about from Bobby's perspective, and I'm sure based on the clients and members and patients that we all serve together, that we know of experiences where this is not a made-up story, but this is actually a reality for someone, the day-to-day ongoing efforts that they're working to plow through the demands of life. And so from your perspective, can you add some of the barriers that we were able to do? So the questions here are, what are some of the barriers for Bobby and his family here? What are some of the barriers for Bobby and his family? And if you would like to come off mute or add to the chat, is it from a social lens? Transportation, thank you, Olga. Okay, so we also have employment. We also have getting medications filled, which ties to transportation. We have financial issues. Yes, Wanda, thank you. Environmental exposures, absolutely. Okay. Health literacy, understanding the prescription directions. Thank you. Very good. Okay. So there are a myriad of areas, and you all were able to touch on them as we discussed. So let's talk and look through this component, understanding how medication works. Absolutely. So one is to get the medication, well, get to the appointment, prescribe the medication, make it to the pharmacy, get home and figure out, we ask the food for medication a lot of times, and then being able to take the medication, understand it, and adhere to it. There's a continuum from just that one light item. So thank you everyone for sharing. We'll go to the next slide if you will, please. Here, as we look at the journey, this is a different view of that life services. And so we like to say, as we said, healthcare with heart, and looking at the continuum to provide those different services. And so I want to kind of explain how CareSource would really work with Bobby. So first is working with our life services. And this is not in a particular order. We would work with our care management and our life services team to really come with a unified and a plan of action for them, a care plan. But I just want to talk about, so we would talk about our life services program. If Dad was interested in enrolling, he would be able to enroll in the program. He would be able to help with education and employment opportunities. We have different arrangements, handshake agreements with different local employers, so we would be able to work in that regard. From a care management perspective, we would be able to enroll Bobby in our asthma-specific program. And so with that, they will receive quarterly newsletters. They will have a plan of action or care plan with their care management who will engage them periodically. They will make sure that they have that health literacy component that they will be able to walk through with them and help them understand the actions and reactions of different medications, what happens in certain environments when things happen. Oh, and Karen, I see that you added multiple ED visits without intervention. Thank you. That is a very good one. I missed that one. Thank you. From a transportation component, as a managed care plan, we provide free education for our members to doctor's appointments as well as social care, food related. So if they need to go to the food bank, we will provide that. And those are benefits that are on an annual basis. They have so many one-way trips that they're able to provide. So that transportation intervention would be into place and really help. Also, medication delivery is something else that's an option. And so being able to. So as you work with patients, clients, members, the big thing is to really help to understand which services and benefits are already in place through their managed care organization that they may not be tapping into. That's a lot of those services are often unused because they are not known about, or just really the complexity, as we saw the bubble chart of life in general, creates ways where somebody may feel as if it's just not one thing, I can't call and understand that more. But really understanding and learning those services is a really big part. Member assistance fund, like I talked about before, maybe there is something that we could help dad with, or a utility bill or something. A lot of those things are happening through the member assistance fund. Sometimes it's not a really big way of a huge charge or a debt that someone owes to keep them housed. It could be something that's very small, and CareSource comes to really be that heart and assist members. And then community and retail relationships, like we talked about, being able to assist. So we may know of a partnership with a specific community organization and being able to help Bobby and his family and his dad tie in and tap into those specific services, whether it's tying into assisting with food or housing in general. So we were able to understand that much of all of your organizations can really help rally around the inequities or the challenges that Bobby and his family are feeling, and the managed care organization can do that. So we can eliminate some of those ED visits when we think that that's the only way that we can get that service, or improving health literacy, understanding more about the medication works. While it doesn't necessarily move their housing at the time, there are some interventions that can really help make their quality of life better while they are still in their current condition. So the next slide, please. This is just some of our mission partners, like we call them. So as a team, and this is just a small example, but we have some partners in the Florida area, and then some at the national level, where we've been able to create opportunities and interventions as well as activations in the communities that you all serve. And so just looking at these, you can see there is a diversity of representation within these specific organizations. And so we know, like you know, that this is where the work really happens. And so we are very grateful for our partners who are just in the community every day and really working to make a difference in the lives of our members. And lastly, if you go to the next slide, please. I'd like to just talk about and show you a few of our member and provider communications. So at first you can see we have a quarterly newsletter that centers around asthma. So if there's an asthma diagnosis with our members, we have these newsletters that are sent out along with the companion to the care manager, the nurse, the community health worker, as well as the life services life coach that works alongside them. So this is a supplement to that, meaning to provide education, access to services, and be able to provide that information based on seasonality or something else that a member may experience. In addition, there is an app called My Health that was used, and in there is a self-guided asthma journey that is used. And within that, that is able to assist members with that education component as well, to be able to assist them to bring light to that as well. From a provider program, I was able to talk to our pharmacy in preparation for this presentation. We have a provider rescue inhaler education program. There in this program, our pharmacy sends out letters to providers to educate them for our members that are primarily or solely relying on rescue inhalers to control their asthma symptoms. And so we know that there is a great opportunity to improve that area. So since the CareSource pharmacy department can look at the asthma medication ratio, they are able to see that the rescue medication is really kind of the primary source. And so we're working to align with the providers to bring them that information so that education can continue to raise. A follow-up will be the third quarter. So that started last year in 2024 to see kind of what has been the improvement in those claims for that specific medication. So I want to stop here to ask questions. If we just go to the next slide, and I will open the floor for everyone. This is just some of our impacts for our social determinants of health programming that we've been able to see. And then we can go to the next slide, please. This, we saw a huge reduction in recidivism for our Housing Connect program. You see we've made a huge investment in our housing investment strategy. And then when we talked about healthy beginnings at home on the right side, you can see some of our amazing results of that specific research study. The time went really fast. So we are here to answer any questions. I would like to thank everyone for your engagement, coming off mute and engaging in the chat. I can't believe our Lunch and Learn is almost finished, so we'll open it up for discussion and question and answer, as well as anyone who would like to share anything, insights or anything from your organization that you would like to talk about. Any questions about any programming? Anything that you're proud about, you'd like to brag about from your program, your organization, as it relates to some of this work that you've seen to come to life, return on investment, challenges? You're here with your tribe of encouragers, so we're happy to help. Any benefits addressing molds in homes? Oh, that's a good question. So I am not aware just yet, but we are the asthma remediation program. Yes, it actually does tie into that. I think there's an opportunity for review of the mold and then an intervention from that perspective. Dr. Wanda, I will get some more information for you for more specifics on which market that's in and more about that. But yes, there has been intervention from that perspective as well. And I asked about how the funding works to support a network of life support coaches. Thank you. So our life services coaches are funded. Actually, we have some grants that we have received from I'm going to pull that up. So we have received grants. We have a HUD grant, so through housing. We have a mental health housing development contract with the Department of Labor. And then we have for the workforce. So some of it is internal to CareSource. It's just an investment that CareSource makes due to our rich history to say we want to fund these specific positions. And then the other way, they're grant funded, where we're able to go out and be able to secure some of those grants. So we also have an Adamus grant that has been long-term for those with substance use. And so we've been able to work. So sometimes the positions are granted or funded by way of the specific subject matter of the grant. And then other ways, they're just like blanket umbrella through CareSource itself. Does CareSource partner with other entities provide asthma management resources? We don't have a specific national partner, but locally, the local organizations partner with specific organizations. Georgia does a really good job, and that's where I was able to get the asthma remediation program response from. But I think there is opportunity potentially as we look at our membership and be able to see maybe at the national level, which is governed by our organization, to see how that could potentially be a partner. You're very welcome. Are there X number of coaches per X number of members? Yes, there is a ratio of members. Not sure if anybody from CareSource can help me here. But we do have, there is a specific caseload. So Ohio is our longest standing market with membership. And so they have a caseload that is, I guess I would say they have more life coaches, but say in Indiana, there are only 3 or 4 life coaches, as well as Georgia. So they have to cover the entire state. So sometimes the work is a little more, it's a little kind of a juggling act, if you will. Some of the markets where we are, so in Ohio, Indiana, and Georgia, where we have our life coaches, it depends on the funding by market too, of how those positions are funded. And so sometimes those employees are doing kind of wearing multiple hats. But yes, there is a specific ratio that they work in, but it depends on the state, as well as, Eric, to your point in your previous question, how many of those life coaches are in the specific state. But we are statewide in the states that we serve. And it is a companion to our care management model. So it is working with them. And so sometimes the social supports are what are primary and what are the most needed and urgent at the time. And then sometimes it's the care manager who is working with them who have those urgent needs at the time. So we work as a unified through a single member view. And that was another thing that we had to work with, is to get everyone in the same documentation system. And so for a while, the life coaches were independently working in a different kind of antiquated system. And then you had the care managers working. So when you worked with that one member, they were receiving kind of not a singular expression of CareSource, if you will. Once we were able to get them in a single documentation system and bring them together, we're able to provide that higher level of care and really be able to see those areas of focus and really prioritize them for the members too. Oh, you're welcome. Thank you for being here. And we're happy to answer any questions. I'd like to, if you would like to reach out to us post conversation, Eric. Dr. Zan, I see you. If you'd like to.
Yep. Just going to encourage people, if you have additional things you would like to ask live, please do put those in the chat or jump in. We have a few minutes left that we can use if you would like. I would also encourage anyone to follow up with Tony later, or in addition to providing your feedback now if there are more things that you would like to discuss. And I'm going to remind everybody that we will have an evaluation survey going out after this event, once I get the manifests of participants and registrants from our Health Council colleagues. So please do take the time to give us your feedback. Y'all have been wonderful with engaging in the chat and with your questions. This has been terrific. So we want to make sure that we give you those opportunities to provide us with feedback today, and also see what other topics you might like to get Lunch and Learn webinars on. And I see another question from Eric in the chat just came in. Tony, do you see that on your screen?
Yes.
All right.
And COBs are community organizations, Eric? I'm sorry if I'm not understanding. Okay, thank you.
Community-based
Yes, okay. Absolutely. So that is really the heartbeat of what we, working with community-based organizations is a huge part. So we work with them at the national and local level as well. And so they help to provide that support. We also have some contract organizations. Oh, no, you're fine. Contracts with some community-based organizations where we have worked to have them assist us in engaging our members that may be hard to reach. And so we've been able to provide investment to their organization, not to totally change their workflow, but to to really serve as a support to their current workflow. So for instance, if they are completing an assessment on their members, could they maybe slide in a couple assessments that CareSource is interested in too, with the member's permission, obviously, and then being able to feed that information back to us. There's an opportunity for bidirectional sharing that we've been able to do and really look at it from that regard. So absolutely, community-based organizations, providers, retail partners, we have kind of the same type of program that we're working on with a retailer. Being able to work in the community has been a huge asset to our programming, as well as assisting our members to really get off medicated stuff. So great question, and thank you. And I would say, just to add, the community-based organizations are so powerful in terms of already having that established trust in the communities. And so being able to continue to capitalize on the work that they're already doing is incredibly important. I will also say community-based organizations have a lot of power in terms of understanding the value of what they bring to the community and membership. And so while there are a myriad of different programs that would come to approach them, I would say understand your power and understand the ways in which that you hold the key that many organizations, like for-profit organizations, are working to unlock. I would say you hold the key and the power to be able to really work the way you would like. And I think there are ways to be able to structure agreements and et cetera to really benefit the vision and the mission of your organization as you continue to move forward. So community-based organizations are because they're so heart-driven, and they have great opportunity for great reward for membership. And I think having the heart in the right place continues to yield great fruit. So.
I love that reflection, the idea that having your heart in the right place continues to yield great fruit. You know, I've been working with this program and coalition for 12 and a half years, and that's always what I come back to, you know, about why I'm always so passionate about working with the Florida Asthma Coalition and the Florida Asthma Program is the heart that people bring to the work. The people change sometimes, and we go through transitions with our roles. We work with other organizations, but that shared heart is always there, and that commitment to always doing better, to always looking for those ways to lean into equity and justice and to bring humility and grace to that work. That really resonates with me. And so I just want to express that appreciation for that idea, because it's very much at the heart of everything we do.
Yes. Thank you for that. And I think sometimes day to day we can get lost. I think we're all advocates in our own organizations and in our communities too, in some level. I think sometimes it can be a little daunting, it can be overwhelming, but recentering ourselves back to our why is very important. And it's not just something to say, it's definitely kind of the breath we breathe some days. Some days you feel like you get the wind knocked out of you a little bit, but continuing to be able to go forward and being with like-minded individuals for something like this Lunch and Learn is very encouraging to know that you're on the right track and you're moving right forward with the hard work of your own. So doing great good together.
All right. Well, I think we can probably go ahead and get wrapped up. Tony, this was an amazing session. Thank you so much for being with us today. This was incredible. And I'm seeing here, Eric is saying in chat, beautifully put, gratitude. I'm echoing that. I'm reflecting that back. And thank you so much to our Health Council colleagues for organizing this, and also to our program manager, Dr. Wanda Dunham, for always working hard and working with heart to make sure that we can bring amazing speakers to all of you who are joining us from Florida and elsewhere. And of course, for continuing to forge those strategic partnerships. In fact, I see Wanda has her ALA background behind her. So this is fantastic. So to be continued, this was a great dialogue and we look forward to nurturing and sustaining it with you. I see Shelby saying in the chat, great presentation. Thank you, Tony, and the CareSource team. Lots and lots of applause, lots of cheers. This was fantastic. Thank you all for joining us today and for the heart that you're putting into your work. We hope to continue these discussions at our summit next month. Registration is open, and if you have questions about that, you can email our floridaasthmacoalition.com Gmail address that's listed on our coalition website, and summit information is also available prominently on the website. So we look forward to seeing you through either the virtual or in-person option for the summit, and to joining you for future webinars. Thank you, everyone. Have a great rest of your week.
Thank you.